Hello everyone, my name is Daniel,
Hey everyone, my name is Chris.
and we are Ronalytics.
Today we're going to be going over data for the coronavirus, focusing on South Korea and comparing to the world. To begin with a world overview, we have this graph of deaths by day, and here we can see that it has been growing quite exponentially throughout the last few weeks. We have chosen to analyze South Korea because the country has been able to take control of the rapidly spreading of the virus within only a week, and has showed a light of hope to the world with its number of confirmed cases going down every day.
So going along the lines that Danny was talking about in South Korea, one of the topics we chose to talk about is a little bit about the time frames of when someone will feel the symptoms of the disease to when that case will be confirmed as a coronavirus case. Now, as you can see on the time from symptom graph, on average, it takes 4 days from when a person feels the symptoms for the coronavirus until it gets tested. Why is this so important, you may be asking? It shows the capability of that country on testing coronavirus cases. Now, during a pandemic outbreak, we see that hospitals, government, scientists, they all spend their time on trying to prevent and minimize all the negative effects that are brought by the pandemic outbreak. It is really important in this graph that we look at the outliers, because they either mean that something is going very efficient and time is good, or something is going bad. So on the bottom level outliers, you can see that in these cases in particular, the people were confirmed with a coronavirus case even before they felt symptoms. This is important on the following way. These people, they can take all the health and social distancing precautions even before they start actually feeling that they have the disease. And what do the upper level outliers say in this graph? These people, they usually take a long time until they get tested. And this shows how time inefficient a system and laboratories and testing might be when this pandemic hits a specific region or country. On these upper level outliers, you can see that it took more than 20 days for a person when they started feeling their symptoms until they actually got tested. As on the bottom outliers, they were tested 8 days before they even started feeling the symptoms for the coronavirus. On the average days until death graph, we've narrowed our data down for only those patients who died. And a question that many public health professionals are asking themselves is how many days it takes until coronavirus patient dies. And we can see in this graph that on average, when a case is confirmed, it takes only 5 days until a patient dies. And that's an average again, but still, it shows a little bit on how the virus attacks our body, and it shows how we need to be fast and get to the hospitals as soon as possible once the virus is contracted in our body. So going along with what I just talked to you on the symptoms graph, here we see that it is really important for communities and countries to develop quick and efficient testing capabilities to prevent death, as we see how quickly this virus affects humans and how it can lead to death, essentially so unexpectedly. As we look a little deeper in our data, we have sorted them out in male versus female cases. Now, you can see the male cases account for about 44% of all of our cases, as the female cases account for about 56% of the coronavirus cases. Now, we will look from those cases that resulted in deaths, and that's also sorted out by males and females. One thing that was really interesting is that even though there were more female cases than male cases for deaths, this kind of switches up. As you can see, there are about 32% deaths for female cases compared to 68% of deaths of male cases. Now, some of you might be alarmed on how this virus affects male and females differently. But one of the things we forgot to account for is if that patient had underlying health conditions or not. If we look deeper into males, you can see that about 40% of them had underlying conditions. Now, as we look at females, we can see that only 29% of them proportionally had underlying health conditions. Later, we'll talk on how health conditions critically determine that a person will be likely to die. Now, going along on explaining death by those multiple factors, we determined that age might be an interesting estimator. And that's because people who are older tend to develop underlying health conditions much easier than those who are younger. We can see in this graph over here that about 85% of people who died were on their seniority age. That is, in the ages between 60 and 90. If we look on the people who are younger than 50, we see that there are only 2 out of 52 cases of people who are younger than 50 who came to pass away because of the virus. So it is really important for you to know that as age increases, so does the number of deaths. And the people of older ages deserve special attention when we speak about preventing coronavirus deaths. Here, to look on age, underlying conditions, gender, and how all these factors determine whether a person will die or not, we decided we will run a regression analysis using linear probability model. How does each one of these factors affect the likelihood of a person dying in terms of percentage points? Now, for all these independent variables, as we ran the regression, we got results that show that they were all statistically significant. And that's important because we don't want to have things in our regression that will mess up with the coefficients we are trying to estimate. Now, looking at underlying condition, we see how this independent variable is important on estimating the number of deaths of coronavirus. Here, we saw that if a person had underlying condition, the probability that the person will die increases by 96 percentage points. That's why it is so important that these people with underlying health conditions will need special attention from doctors, government, and public health officials. If we look now a little deeper in our regression, you can see that if a person is male compared to female, the probability that that person will die of the coronavirus increases by only 1.5 percentage points. So that's not a whole lot as we look into our regression and statistics. Now, here as we look at age, we see that if the age of a patient increases by 1 year, the probability that that person will die of the coronavirus increases by 0.1 percentage points. It doesn't seem like a lot, but as a person gets really old, these results can be quite alarming.
On the geographical side of the analysis, while analyzing South Korea, we've noticed, as you can see in this graph right here, that within confirmed cases, the number of deaths was relatively small. However, further analyzing this graph of deaths and sorting by provinces, we've been able to identify that 2 of the country's provinces were responsible for over 90% of all its country's deaths. Gyeongsangbuk-do and Daegu together had a total of 48 deaths out of 53 deaths, and that became a big question in our study. As we try to answer why these provinces were responsible for most deaths in South Korea, we came across some news explaining there had been a large outbreak. And as we read in a New York Times article, people had been blaming the Shincheonji Church of Jesus located in Daegu area for the early outbreak in the country. With this information, we decided to look more thoroughly on cases by province. And in this graph here, we can see the map of South Korea, and we can further analyze Daegu, where the church was located, and we can confirm that indeed most of the cases did come from the church outbreak. Further analyzing our cases by province graph, we can analyze the province of Gyeongsangbuk-do, and in this graph we can see the church outbreak also had a great impact. However, the thing that catches our attention in this graph is the big bar for the contact with patient. A very likely explanation for this is that the province of Gyeongsangbuk-do surrounds the Daegu province, where the church was located.
So, as a conclusion about our coronavirus analysis, we came up statistically that in order to determine whether a person will die or not, there are 2 main things that affect that. And first is the age of that person, and second, and most important, whether that person has a medical underlying condition or not.
Through our analysis, we've been able to clarify that South Korea had a quick reaction towards the virus outbreak and has been able to contain it since then. Also, with our analysis, we support Max Fisher when he says we can learn from South Korea, and that what may keep us from achieving the same results as South Korea may be political will, public will, or it might just be too late, since their initiatives are very dependent on the early stages of the spread of the virus.